Hello, welcome to another episode of Pulmonology Read Aloud, and today we'll be talking about history taking of smoking. Smoking history taking is extremely important whenever you're seeing a pulmonology case because this one symptom or this one habit that you elicit can guide you to the right diagnosis. Now, whenever you take the history of smoking, it's very, very important that you ask the age of the patient because COPD definition, cancer risk, they are all related to age. Ask about their occupation. Certain occupations have more smoking history. Ask about other exposures. In females, do not forget about chula exposure. And in males' work, ask about industrial exposure. After you've done that, it's important to define whether your patient is a current smoker, non-smoker, or an ex-smoker. If he's smoking every day or some days, he's a current smoker. If he's not smoked, never smoked, he's a never smoker. These definitions are very important. You'll find them in Harrison's, you'll find them on CDC's website, and usually unanimously the definitions say that anyone who has smoked more than 100 cigarettes in his lifetime will be classified as a smoker, and who's never smoked will be a never smoker. Someone who smoked less than 100 cigarettes in his lifetime is a non-smoker. For the terms former smoker and reformed smoker means it's been around a year that he has quit smoking. But again, this criteria of 100 cigarettes is in the definition. For a former smoker, if he's in the process of quitting and it's been around 6 months that he hasn't smoked, you can call him a former smoker. These definitions vary between guidelines, and it's important for you to basically adhere to whichever country guidelines that you're following. So if you're in India, then the guidelines which are included in your Indian text would be more significant. New Zealand has its own guidelines, so every country has different guidelines, but more or less this 100 cigarette criteria would stand true. I'll give you an example that if a patient smoking say 10 cigarettes a day, he was earlier smoking 20, he's a current smoker. If he has recently quit in the first 6 months, then probably he is a former smoker. If he's quit around 2 years ago, he'll become a reformed smoker. Ask about the age of smoking initiation because that way you'll know about the years of exposure. This is how you calculate the years of exposure. Remember to give the accurate description. Also ask him how many years has he actively smoked if he's a former smoker. Ask a patient how long it has been since he's last smoked to distinguish between a recent former smoker or a long-term former smoker more than 5 years, because it cuts down the risk of several diseases if he has smoked more than 5 years ago. It's also important to ask how many cigarettes or bidis or cigars or pipes or e-cigarettes he smoked. You remember the number of cigarettes usually in a packet is around 20. The number of bidis can vary as in India. So most will contain 20, but some packets will contain less. So you need to ask your patient how many does his packet contain. When you know the number of packets, you just need to calculate the pack years for smoking cigarettes. So if 20 cigarettes in a day for a year, then that is 1 pack year. If he's smoking 2 packs in a day for a year, it's 2 pack years. If he's smoking bidis, you calculate smoking index. This is the number of bidis into the years of exposure. How do you calculate pack years? So if suppose he says, I don't smoke a pack in a day, I smoke 7 cigarettes in a day, then you take the number 7, you divide it by 20, multiply it by the number of years he smoked, and you know your pack year. So calculation of pack year is very, very important. Some forms of smoking like pipes and cigars and hookahs give you more smoke exposure, which may be equivalent to a pack of a cigarette. So make sure you specifically ask for those and mention them in your case sheet. What is smoking to the butt? Well, some patients will smoke right till the very end of their cigarette. That's called the smoking to the butt, and this end contains a lot of ash, a lot of nicotine and tar, so it is highly dangerous. And 30% of a cigarette's original length is the butt, so a person who's smoking to the butt has more exposure. Nowadays there are concepts of filtered cigarettes, non-filtered cigarettes, menthol cigarettes, flavored cigarettes, and remember that these additive filters, which are mostly cellulose acetate, are there to reduce the amount of smoke, so make it less harsh. So it does reduce some amount of the risk of COPD and cancers, but the nicotine and the carbon monoxide will not change. You can also inquire about certain specific habits according to the geographical area you're in. In India, for example, there are a history of reverse smoking that can be taken in certain populations, where the patient will first light up the cigarette and put the lighted end in his mouth. It is gross, but yes, this has more exposure, more burns, and more oral cancers. If you want to know about more indices of smoking calculation, then there's one index called Indrayan's index, which is more practical in the term that it also considers the exposure and the effect of passive smoking and gives a multiplier for the various kinds of the cigarette the patient is smoking. If you ask most of these questions in your history, then more or less you will be able to give an accurate history of smoking. Thank you. That's all for today. I'll meet you again another time.